What is HMP virus? Have you ever wondered about some of the lesser-known viruses that can impact our health? While names like the flu or COVID-19 are frequently discussed, not many people are aware of the human metapneumovirus, commonly referred to as HMP virus. Today, we'll take an in-depth look at what this virus is, how it could affect you and your loved ones, and the simple steps we can all take to stay safe. Let's dive in. Human Metapneumovirus, abbreviated as HMP virus, is a respiratory virus that affects people of all ages. It was first discovered relatively recently in 2001, which is why it remains unfamiliar to most. Despite its unfamiliarity, it has earned attention due to its global prevalence and its capacity to cause widespread illness. The HMP virus is classified as part of the same family of viruses as respiratory syncytial virus, RSV, which is also known for causing respiratory infections. Since its identification, studies have shown that this virus circulates worldwide and can infect almost anyone, regardless of age or location. While anyone can catch the HMP virus, certain groups are especially at risk of developing severe symptoms. These vulnerable groups include young children, as their immune systems are still developing; older adults whose immune systems weaken with age; individuals with weakened immune systems, such as those undergoing treatment for chronic illnesses or autoimmune conditions. It's important to note that even healthy individuals can develop symptoms, though severe complications are less common among them. Understanding how the virus spreads is key to protecting ourselves and others. Like many respiratory infections, the HMP virus is highly contagious and spreads through several pathways. Close contact, direct interaction with someone carrying the virus, such as shaking hands or sharing personal items like towels or utensils. Respiratory droplets. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the air. If these droplets land on another person's mouth, nose, or eyes, they can cause infection. Contaminated surfaces. HMP virus can also survive on surfaces like doorknobs, counters, or toys. If you touch these surfaces and then touch your face, you risk infection. Because of these transmission methods, crowded places such as schools, offices, and public transport are particularly high-risk zones for the spread of the virus. The symptoms of the human metapneumovirus can vary from mild to severe, depending on the individual's health and immune system. For most people, the symptoms resemble those of a common cold or flu. These include fever, cough, nasal congestion or runny nose, sore throat. In more severe cases, particularly in vulnerable populations, the virus can lead to difficulty breathing or wheezing, chest tightness, lung infections like pneumonia, bronchitis or inflammation of the airways. While these symptoms overlap with those of other respiratory infections, it's the complications in high-risk groups that make the HMP virus a significant concern. If you or someone you know experiences difficulty breathing, it's crucial to seek medical attention immediately. At present, there is no specific antiviral treatment available for the HMP virus. However, most cases can be managed at home with supportive care. Here are some effective ways to ease symptoms and promote recovery. Rest. Let your body heal by getting plenty of sleep and avoiding strenuous activity. Hydration. Drink lots of fluids such as water, clear broth, or herbal tea to stay hydrated and reduce congestion. Over-the-counter remedies. Medications like acetaminophen or ibuprofen can relieve symptoms such as fever and body aches. However, always follow dosage instructions and consult your doctor if unsure. Humidifiers. Using a humidifier in your home can ease nasal congestion and make breathing more comfortable. If symptoms worsen or do not improve after a few days, it is essential to contact a healthcare provider. Since there is no specific treatment for HMP virus, prevention is your best defense. Fortunately, many of the preventive steps are simple yet highly effective. Wash your hands frequently. Use soap and water to wash your hands for at least 20 seconds, especially after coughing, sneezing, or touching shared surfaces. Avoid touching your face. Try not to touch your eyes, nose, or mouth, particularly after being in public spaces. Cover your mouth and nose. When sneezing or coughing, use a tissue and dispose of it properly to avoid spreading the virus to others. Clean and disinfect frequently touched surfaces. Regularly clean common surfaces like countertops, doorknobs, and shared electronics to limit contamination. Stay home. When sick, if you experience symptoms of a respiratory infection, stay home to avoid spreading the virus to those around you. By adopting these habits, you can significantly reduce your risk of infection and help protect your community. Developing vaccines. Scientists are working to create vaccines that could prevent the spread of the virus and protect at-risk groups. Treatment research. Efforts are underway to discover antiviral drugs that can target this specific virus and improve recovery rates. Although these advancements are still in progress, the medical community is optimistic about future breakthroughs that could make managing and preventing the HMP virus more effective. Awareness is a powerful tool in combating the spread of respiratory viruses. By staying informed, you can help protect not only yourself but also those around you. Share this information with your family, friends, and colleagues to ensure everyone understands the risks and preventive steps related to the HMP virus. Educational campaigns in schools and workplaces can play an essential role in promoting hygiene practices and reducing the virus's impact. Remember, every small step toward prevention counts. It spreads through close contact, respiratory droplets, and contaminated surfaces. There's no specific treatment, but symptoms can be managed with rest, hydration, and over-the-counter remedies. Stay safe, stay healthy, and share this information to help create a safer world for everyone. Together, we can make a difference. This video provides general information about Human Metapneumovirus, HMPV, and is not medical advice. For any health concerns, consult a healthcare professional. Thank you for watching Healthy Doses.